it over to Darla, and there you go. You're all set.
All right, thank you. Good morning, everyone. Thanks for being on here for your benefit information for 2023 City of Detroit open enrollment. Does anyone have any questions before I get started? Guess everybody's muted. Can you hear me? Can everyone hear me?
We can. Yes.
Okay. All right. Just wanted to make sure. Can you see my screen as well?
We can.
Okay. So we're going to start with basically a short history of HAP. HAP's a trusted healthcare plan that's been around for 60 years. We were founded by Walter Reuther in 1960. We have over 430,000 members, 660,000 members, as a matter of fact, and we have 970 employees. We are an integrated physician-led health plan, and we have leading hospitals, network of physicians, and we have a regional presence in the area. As a HAP member, you have access to our entire HMO network. And someone had asked about out of coverage. Out of coverage is available for urgent and emergent. If you're traveling, you're going to always be covered for urgent and emergent, no matter where you are. We have more than 5,770 PCPs and over 18,000 specialists in our network. Selection of PCP is required. No specialty referrals are needed. So if you needed to see a cardiologist or a podiatrist, as long as you're using a doctor that's participating in our network, you do not need a referral. If you want to know if your doctor participates, you can go to hap.org, a doctor, and you can always call your doctor and ask if they participate in Health Alliance Plan HMO. As a HAP, you can choose from thousands of doctors in addition to Michigan's leading hospitals, including these below. Henry Ford, of course, Spectrum, U of M, Mercy. You can see the hospitals that are here on the screen, Beaumont. Prior authorization versus referral. On your referrals, if you need to see a specialist, HAP does not require you to get a referral in your network if you're using a doctor in your network. However, sometimes your specialist may ask you for a referral from your provider, which your primary provider can do. The schedules for certain specialists get filled months in advance, and they may only accept patients whose PCP believes the patient needs specialty care. So the things you need for a referral is seeing a provider outside of our network, and if the specialist asks you for a referral from your PCP. With the prior authorization, HAP works with the PCP and the specialist to ensure that the patients receive the right treatment at the right time in the right setting. So that's why we want you to check with us so we can manage your care. This process is called a prior auth, and your PCP will request a prior auth from HAP on your behalf. Things you need a prior authorization for are things like MRI, CAT scans, hospital stays, some medications, and surgery. Any questions so far? Okay, understanding the cost share. The types of cost share that you may be responsible for paying could be a deductible, and that's the amount you owe for certain covered healthcare services before your health plan begins to pay for them. You may include per person deductible amounts and family amounts. Usually how I remember the copay is usually that's a fixed amount, and this is the set amount that you pay each time for certain healthcare services, medications, and other supplies. So like if you go to the urgent care, that's a fixed amount. If you go to the emergency room, that's a fixed amount. Your co-insurance, I remember that by it being a percentage. So your co-insurance is the percentage of the allowed amounts that you pay for certain services after your deductible has been met. And your out-of-pocket limit is the most you will pay for covered services during a benefit period, usually a calendar year, before your plan begins to pay 100% of the allowed amount. All copays, co-insurance, and deductible amounts count toward the out-of-pocket limit. And so your plan design that's set up with HAP through the city of Detroit, you have a $750 deductible. So one person would meet that, but two or more, which is considered family, would be $1,500. There's a 20% coinsurance. We talked about a percentage. There's a coinsurance max of $1,500 for one person, $4,500 for family, two or more. And then your copays, your preventative services are covered. Your PCPs are $25. Your specialists are $25. Your telehealth is $25. Your emergency room copay is $100, and your urgent care is $25. And then new for 1/1/23, there's a zero copay for postnatal care. Your prescription drug copays for your preferred generic, there's a $10 copay, non-preferred generic, 10, preferred brand drugs, 35, non-preferred, 50, specialty drugs, preferred specialty, 50, non-preferred specialty drugs are 50. And if you need more information on HAP's covered prescription drugs, you can learn more at hap.org/prescription-drug. And of course, your mail order is available through Pharmacy Advantage. So when you need care, there are several places that you can immediately get it. You can get it from telehealth. You can get it from your PCP. You can go to urgent care, and you can use the emergency room. Your cheapest, of course, is always going to be telehealth. Then the next would be your primary care. The more urgent, and then emergency room is always going to cost more. You should always try to use urgent if you can, because if they can treat you, you're usually there less time and with less cost share. So we also cover students away at school for those of you who may have students away. 17 to 25 attending school out of HAP's service area will be covered for urgent and emergent, no matter where you go. Non-emergency and minor illness or injury, routine allergy injections, flu shots, and immunizations, prescription drugs, and then of course your copays will apply. And there's an asterisk here saying that outside HAP service area authorization is needed for all services, of course, except for urgent or emergent. So if your student has a chronic condition, you can let us know that, so we would know how to best treat that and help your child get the care they need away from home. Services students should get at home would be preventative services like your physical exams or surgeries or something like that. You'd want them to have something like that when they're home. We have a travel program called Assist America. If you're 100 miles or more away from home or out of the country for less than 90 consecutive days, and members are covered for urgent and emergent. I keep saying that because I can't emphasize that enough, that members are always covered for urgent and emergent. That's like one of our biggest questions is, what if I'm in an HMO and I travel? You're always going to be covered for urgent and emergent. There's an app you can download, and it will tell you, you can when you push the button, it dials right in and they can help you. That's available 24/7. Also a part of that program is an identity theft protection, safe continuous monitoring and fraud support, assistance if you are a victim of fraud, and you can get your exclusive access code in your hap.org account. So 24/7 identity fraud, online credit card document registration with lost and stolen recoveries, assistance by phone, and credit and debit card internet surveillance when cards are registered online. All a part of Assist America. Now, we have some online member capabilities at hap.org where you can see your claims, you can look at your EOBs. Just be aware that if anyone on your policy is over 18, you are not going to be able to see any of their information. So you can look at your claims, you can look at your benefits, and you can get coverage. You can request new ID cards. For your care, you can see referrals, prior auths, care management, if you're getting MRI, CAT scan, or something that you need a pre-auth for, forms and documents, well-being, you can do links, wellness opportunities, iStrive assessments, you can keep record of, whether you're losing weight, your blood pressure, all type of wellness activities. And then we have a members perk, which lists all HAP member discounts. We also have a health care cost estimator tool. Medical treatment costs can vary widely among doctors and facilities. And so what people can do is we've made the process easier with our new online tool. It gives you estimated prices on doctor visits, procedures up front, and that way you will know what your cost is if you have any. So the tool lets you shop for treatment options, compare prices, show where you can save, gives you an average cost of treatment options in your area. It shows your personal out-of-pocket costs for a treatment, and it educates you on some of the tests, treatments, and medications that may be part of your overall treatment plan. It's a really good plan. And so we've added many mobile apps to our feature, which I'm finally glad we're finally getting up into the 20th century with some of this digital stuff. But now you can download My HAP Card, which will be your digital HAP ID card on your phone. It will show you how to find doctors. You can get ID cards on your phone. If you have dependents that are younger than 18, you can get their ID cards on there as well. It will show the front and the back of your card. You just enroll with that. Of course, you can see a doctor on telehealth on your phone or your laptop. Assist America, I spoke of that. If you are 100 miles or more away from home, need urgent care, urgent or emergent, and you can have urgent or emergent no matter where you are. You don't have to be obviously 100 miles away from home, but that's another app. Wellness by Your Side, which is iStrive, which is going to keep you, a better way to keep track of how you're doing. And then whatever your discounts, HAP discounts, the discounts that we give members. So you can download all of these on your phone. Are there any questions? Here's information on member service. I'll read it to you, even though I'm sure you could write it down. 313-872-8100 is the local number, and the 1-800-422-4641 is the toll-free number, and they're there Monday through Friday from 8 to 7. And you can always go to hap.org. And that's the end of the presentation. Are there any questions?